It's very common for younger women to have menstrual problems or acne, especially if they have something called polycystic ovary syndrome, and we call that PCOS commonly. This is actually an insulin-resistant state, and what that means is that, of course, the hormone insulin may have to work harder to normalize your sugar. This is very common and actually is a reason why you would be at higher risk of getting type 2 diabetes just like your mother did. So what should you do? Well, number one, you should probably go to a healthcare professional and see if it truly is polycystic ovary syndrome, number one. And number two, on an annual basis, you're going to need to have your sugar checked to make sure that you don't develop type 2 diabetes. Consequently, some of the medicines that actually treat PCOS actually treat diabetes as well, such as metformin. So actually it may work out well that some of the medicines that help treat one will help treat the other. The other is, how are you going to know if you're insulin resistant? There's not a good way of knowing this, but the symptoms you have could be due to other things as well. So talk to your healthcare professional. And insulin resistance is something that in some people, especially African Americans and people of color, Hispanic, Asians, some people will have what's called, and this is a fancy word, but it's called acanthosis nigricans. And this fancy word simply means that around your neck or under your arms you may have darkened skin. And this darkened skin actually may mean that you have insulin resistance. So if you look at your neck and it looks kind of darkened, it may not actually be that. Many people come into us and they say, oh, I've tried to rub this darkness off my children's neck for a long period of time, and they can't. Why not? Because it actually is a darkening of the skin. The skin color is different than the surrounding skin, and it tends to be in the neck or in the axilla or basically under your arms. If you have this darkening of the skin, it'd be worthwhile, especially if you have a history of one of these types of PCOS or type 2 diabetes, to go in and have your sugar checked to make sure you don't have diabetes as well.